So there's a way we can actually use the placenta, that's the thickness of the placenta, to be able to know the age at which a pregnancy is at. So you want to know the gestational age, that's all those first month, second month, and all of that. We can use the thickness of the placenta, that's on ultrasound. When you do an ultrasound like this, you can be able to use the thickness of the placenta, for you to be able to know the age at which the pregnancy is at. So it's a parameter is used to estimate what fetal gestational age, right? All right, via ultrasound. So it's actually gaining attention. That's what I mean. So I'm even talking about it. So it can be used to actually determine it, especially in the second and or third trimester. So what is placental thickness? Of course, here you can actually see this arrow. This arrow is trying to actually point. Okay, no. This is what the placenta here, right? So you're trying to know, right, how thick this is. So the vertical measurement of the placenta is the level of the umbilical cord insertion, right? Typically in millimeters. So it is about 14 millimeters at week 12 and about 35 millimeters at week 40. So correlation with gestational age. Studies show a strong linear correlation with placental thickness and gestational age, especially in the second and the third trimesters. So it also correlates with other fetal biometrics like what? Biparietal diameter, head circumference, femur length, abdominal circumference. Okay, so you can actually use this. Okay, you can actually use this. So use this to actually, if I'm saying at 12 weeks is about 14 millimeters, you say if 14 millimeters will give it 12 weeks. Okay, if you now do the ultrasound, maybe you get like 20 millimeters, you say 20 millimeters will give you X, cross multiply. Do you understand? So this is a normal range. So anytime you always do the ultrasound, you always use this normal range as reference. If this will give you this will give you X, always cross multiply. You understand? So supplemental tools is useful when traditional dating methods like last menstrual period are unreliable. You understand? Then small-for-gestational age fetuses. Okay, so thinner placentas are often associated with small-for-gestational age. So sometimes the gestation age of the baby, but you just want to confirm how thick the placenta is. Now this will help you know if the baby is smaller than its normal size that is actually supposed to be. So just so you know that we can actually use the placenta to determine the age of a pregnancy.